New study out, more than 5 million Americans living with Alzheimer's here. More people are becoming affected. Every 67 seconds, someone in the United States develops Alzheimer's, the devastating disease which robs people of their precious memories, and a whole lot more. Tony Cruz, Cindy Sullivan, joined by Dr. Albert Pang, who's an optometrist. And apparently, Dr. Pang, first of all, good morning to you. And secondly, people in your occupation now can help see maybe the onset of Alzheimer's. Is that correct?
That's correct. And the latest study, one of them is from an Australian group, and then the other one is also from a company in Massachusetts, have developed two very exciting technology. And the first is called the retinal amyloid imaging. Beta amyloid is one of the marker for Alzheimer's disease. They accumulate, between the nerve cells of the brain, and now they were able to use technology to scan the retina, that's the inside surface of the eye, to see whether the marker is present in a person. And if they find the marker, they were able to positively identify this person is suffering from Alzheimer. And then there's also another technology is using similar technology, but detecting the amyloid protein from the lens of the eye. So it's exciting because we were able to detect Alzheimer's in a very early stage now.
Well, and Dr. Pang, this is important because the medications that are available now for Alzheimer's disease are only those that are able to try and delay the onset or severity. Is that correct?
That's correct. Actually, there's a lot of, unfortunately, the medication, the treatment that we have for Alzheimer's is more for coping with the behavior or the mental status of the sufferer. There's not really a lot of good medications to stop the degenerative process of the disease. But I can see that this detection is a first step of many steps to have effective treatment for Alzheimer's. So once we identify this possibilities disease on a certain individual, probably new medication we're able to develop to stop the degeneration of the brain cells.
So, Dr. Pang, I know this is a little off the beaten path, and we talk about the windows being the eyes into the eyes being the window into the soul. And I have had some friends of mine that have actually gone to an iridologist, and have this iridologist actually told them some pretty amazing things about their health that otherwise he wouldn't have known. Do you have an opinion about this sort of thing? I know that what you're talking about is very high technology, and this is not.
No, I have declaimed ignorance about that, but now there is certain blood vessel pattern on the scalp, on the white portion of the eye, that are able to indicate certain diseases like rheumatoid arthritis, and certain disease can really able to read from the white portion, the blood vessel pattern of the white portion of the eye. But talking about reading the iris to determine whether the certain person have a diseases is beyond my pay scale.
Well, Dr. Pang, speaking of Alzheimer's, though, apparently there are brain plaques or something in the retina lenses of the eyes that you were mentioning. But also, are there any precursors that you guys can detect for either Alzheimer's or any other disorders or diseases?
Of course. My guess you're asking is there any other disease we can detect from the eye, or any other precursor we can detect particularly to Alzheimer's?
Yes.
For now, the beta amyloid is the only marker that we are detecting for Alzheimer's. Of course, there's other diseases you can detect by looking at the insides of the eye. Very simply, you probably already know high blood pressure and diabetes, we were able to detect from the eyes. And also certain drug toxicity, like certain people taking Kerataconus, they were able to find the toxicity of the eye through the retinal examination.
Dr. Pang, do you have any sort of sense of how long it will take this technology to get to the regular guy so that we can go through this testing to determine whether or not we might be one of those people?
Yeah, interesting you asked. The retinal scanning, the retinal amyloid imaging is probably further down the road. But that the lens, the Ligand scanning of the lens, is probably coming up very soon, because the other day I received another invitation by a manufacturer to look at this instrument. So I'm thinking that it's probably going to come up a year or two. We were able to utilize that technology for detections of Alzheimer's.
Well, yeah, I think your job's going to get a little more difficult because now there's even an Australian optometrist, Stephen Mason, discovering a new way to use scans of people's tears as passwords, which he calls the world's first one-time biometric PIN number. In other words, you're going to be in charge of making sure I can get into my computer and only I can through my tears. How about that?
Yeah, that's right. That's a very kind of like a mission impossible thing, right?
Yeah, well, it's happening, though. So your whole industry's changing right before your eyes, so to speak. No pun intended. Well, maybe it was. So.
Yes. Yes.
Dr. Peng, thanks for your time. We really appreciate it.
Thank you.
Dr. Albert Peng, thank you, Cindy. Cindy's going to be back, of course,